Good morning, everyone. I'd like to call this meeting of the Cook County Public Health and Human Services Board to order on Tuesday, October 15th, 2024 at 8:31 a.m. First item is the approval of the consent agenda, which includes our meeting agenda. On the consent is the minutes, financial report, abstracts and bills, approval of the Children's Mental Health Screening Grant, approve the hire of Kristen Pedersen as eligibility specialist, approve the hire of Marissa Eckel as a Children and Family Services case manager. Are there any adjustments to the agenda or any items a commissioner would like to pull? Commissioner
Yes,
Johnson?
I'd like to discuss the two hires, F and G, please.
Okay. And let's see, we'll probably move that down to maybe director's report, or is that fine?
Yeah, I'll speak to the hires under my report and
Great.
can ask for board action at that point or during items for board action, whatever you
Yeah,
Oh,
I just have a couple of
gotcha.
questions.
Yep. Yep, all good. Thank you. Any other adjustments, requests? Else, I'd ask for a motion to approve.
So move.
Thank you, Commissioner Storley. Is there support? Support. Thank you, Frank. Motion and support. Any further discussion? Hearing or seeing none, all in favor?
Aye.
Aye. Opposed? Motion passes unanimously. Thank you all. Down to item 3, introduction of new staff. I'll pass it over to Allison to introduce Betsy.
Good morning, Public Health and Human Services Board members. Very excited this morning to introduce and welcome Betsy Blaisdell to the Public Health and Human Services Board, and it's just been a couple weeks now that she was welcomed to the team on September 23rd. Betsy is working in one of 2 office support case aide positions. You might remember that within the last year we modified our economic assistance case aide position to work within the same job description as our other primary front office staff person, Leanne Avery, being in that role. So really grateful that we have now a fully staffed front office team. It's such a critical team to the operations of our department and service to the public. Betsy brings really incredible customer service experience working in multiple complex computer systems from her time with the YMCA here in Cook County, and we're really glad to have her on board, especially as we're launching into the new world of CaseWorks.
Welcome, Betsy.
Hi, good morning. I've been fortunate to meet many of you in different circumstances over about the 20 years that I've been here in the county. So grateful to be part of this team. As she pointed out, I have been an office specialist in a few roles here before, side at the desk. So thank you so much for welcoming me here. It's been a great introduction with the staff up there, Allison's team, and many of you saying welcome to me as well. So thank you very much.
Thank you, Betsy. Welcome aboard, and yeah,
Thanks.
we're very fortunate to have you.
Thanks, Dave.
Any questions for Allison or Betsy? All right. Have a great day.
Thanks.
We can move on down to item 4, our director's report. And first, let's talk about items F and G, if we might. Just questions from Commissioner Johnson on this.
Absolutely.
Yeah, my questions are, do these people live in Cook County?
Yes. One of the hires lives in Cook County and the other is in the process of relocating to the county and, to my knowledge, has housing secured here.
And so the hire that is not currently living in Cook County, when is the anticipated time that they will start while living here?
That is still contingent on their ability to find housing. They are actively searching. We have staff supporting them in identifying housing options. Every meeting that they're attending with other county partners, they're bringing up the fact that they're looking for housing. So it's really all hands on deck in terms of supporting that individual. I'm assuming you're referring to David Ritmo, our recently hired coordinated crisis response worker. He is working remotely at this point. There's a lot of content that he can review and go through in terms of online training, some of the work that's been done to date to develop policies and procedures around our in-development coordinated crisis response pilot. So he is currently working from his remote location and in the process of identifying housing. So any leads are welcome if you're aware of any housing opportunities that might be opening up. He's on the list. He's speaking to landlords and realtors.
Yeah, I understand that, but my question is, I realized maybe I should have asked this last month, which is why I'm bringing it up with these 2 new hires today. Do we have a time frame? I mean, I think the people that work in your office or your department, it's kind of important that they are physically here at times. I get remote work for some things, but it's kind of important that people are actually here able to meet with clients. And so I'm wondering, how long of a time frame do we pay somebody to live someplace else?
Commissioner Johnson, I can give some context in terms of other direct service roles. It's very rare that an individual upon their first date of hire would be immediately meeting with clients or service recipients. Typically, that phase of onboarding to learn the systems, to learn the process, the policies that govern our work of our department is about 3 to 6 months. So I think that although we don't have a designated time frame for him to be physically present on site in Cook County, 6 months would be, I think, a equivalent comparison for other county staff at the point that they begin working to when they are providing services to community members.
And I will just express my concern with that time frame. I think we need to tighten that up somehow, and especially with the crisis worker. When we discussed that last year about that position and how that person for 6 months never ever met with a client. And I was informed that we had things in place because of that 6 months, that the next hire would be physically meeting with clients and doing the work. So I have a concern that we may go 6 months again, and I would like to see a training schedule, what the actual training is that we are assigning to these new employees that takes 40 hours a week. So.
For just this?
I guess I would like to see it for all new positions. I don't understand, and actually it was discussed at AMC meeting, district meeting, about the challenges of DHS training requirements. And I realize I don't have a good sense of what that entails, so I would like to see what that does entail. What are the trainings that are required? What do we do? And how long we expect that kind of training to take? And I just meant 40 hours a week sitting in a computer doing training. I don't know. Is that what we're expecting? I don't understand. So that's the part I would like to see, that information.
I'd be happy to share a copy of our department orientation and onboarding checklist with you, Commissioner.
That'd be great.
It's very rare that we are hiring someone into a case management direct service role who has the experience to be able to start providing services on day one. So that is the rationale for that 3 to 6 month time frame, in addition to, as you mentioned, the pretty significant onerous training that's required just to operate the documentation system that our staff are required to use.
Yeah, I'd just like to get a better sense of what we do and how it works, so.
And if
I will just also reiterate that I have a concern with hiring people and paying salaries for people that are not Cook County residents. And I get that our housing situation maybe causes frustrations there, but that is still tax dollars leaving our county, and I have a concern with that.
And if
So
I
we
may
just need
make
to
you,
be aware of
Commissioner,
that.
this was posted for 18 months, and we did not have any qualified local residents apply. And in lieu of having the position vacant, this is the best alternative. And it's not just computer-based training. He's participating in meetings. He attended a tabletop exercise on his very first week, in which, for several hours, we met with law enforcement, hospital, Grand Portage Human Services, Public Health and Human Services staff. So he's not just doing web-based training. He's working to develop relationships. He's meeting the folks that he's going to be working with in terms of department staff and other professional entities working within the coordinated crisis response field.
Question. So does he come here when he met with all those people, so he got to meet them in real life?
He visited the county as a part of his interview process. In his first week, that meeting was virtual. So it was a hybrid meeting with some of our participants, including him attending virtually and some in person at the community center.
And I would like to see also what you're sending Commissioner Hawkins. I'd like to see the onboarding requirements for this position, or any position, if there's one that covers for your department.
Well, I was curious, I think DHS has maybe above and beyond requirements, but I imagine that a number of our departments also have state requirements, and I didn't know if those are of interest, or if we should take an inventory of what all the state requirements are for all departments, or what
Would
the
be
aim
interesting to
is.
know, I think.
I don't know how much of a role HR has in that, or if it's just department based on the state requirements, or any insight there.
I'm sorry, I was.
Gotcha! No, we're just talking about,
And then I caught on to like the second half of your
Yeah.
question, Dave. Sorry, what was the first part of that?
yeah, so we're talking about state training requirements, and just kind of the next level that DHS has. And if there are other departments, which I assume, such as assessor or auditor, that also have state training requirements, and just kind of what level those are at as well. And I didn't know how much of a role HR actually had in that, or if it's just department by department that has to ensure that the state training requirements are met.
Right, the state training requirements they don't fall under my wheelhouse.
Right, okay.
I am not 100% aware of all of the state requirements throughout the different departments, but it definitely is on a departmental basis.
Yeah.
Just with my experience in a couple of different offices here in the county, PHHS does have a very significant amount of initial training that you have to go through before you can even look at any client-related data.
Mhm.
And like the assessor's office, you can pretty much jump in right away with on-the-job training and then eventually work into those classes to work towards like your CNA and other level of licensure. So I'm not aware of any other department or position that requires that level of training right off the bat. I was going to add a side note too. I met with David yesterday virtually to do his HR onboarding. We've had to reschedule a couple times because there's been a couple of hurricanes that he's had to deal with. But even with David having been on the job for a couple weeks, he's still referencing the training that he is still going through. So it is a fairly lengthy process.
Yeah.
Mr. Chair?
Yes, please, James.
Yeah, I'd just like to clarify some expectations. So I understand that there's been a request for the specific training plans for a couple of employees, and I'm just wondering, first of all, I want to acknowledge Commissioner Johnson's concerns. I think her questions are reasonable. I think when we have new employees starting who are not yet in Cook County, there need to be clear expectations about, what is the timeline for them actually getting into the county. That said, I think, if the board wants general information about how we train and onboard new employees, I think that would be fine. I'm concerned, what it sounds like is that we're opening the door to having the board review training plans for all new employees. And that's a level of oversight that is just not appropriate for the board. That's really an administrative function.
Yeah, and I think I hear what you're saying, Administrator Yorkie. I think it's a curiosity because we have new hires, but also just the discussion, it sounds like at the District 1 meeting about just kind of the level, kind of that next level onerous requirements, and trying to have a better understanding of what that actually means. So I don't know that it's the oversight necessarily as much as a curiosity and wanting to be better informed. Unless I'm Yeah.
That's great, because I mean, if the request is to forward all training plans for all new employees to the board.
Sure, yeah.
I can see that becoming really onerous.
That also would be next level, yeah.
Right,
Yeah.
right.
No, I gotcha, thank
Okay.
you.
Thanks for that.
Yeah, thank you. Yeah,
If I may, yeah, directly to Mr. Yerke's point, I don't think it's so much a question of training plans for each individual employee as for a position. Just like you have a position description, you'd have a competency list. Employees filling this position must be competent in the following areas. And this is standard. I mean, they are published, they are nationwide. I'm more familiar with the public health rather than the behavioral health aspect of things, but they are absolutely standard. And one of the considerations when you hire somebody would be, how much training will they need to bring them up to the required competency level? Some people might be there already, and now it's just a question of learning this computer system or, or that meeting schedule. Others may have gaps that need to be filled, and that's fine, and that's certainly a function of the director.
Yeah.
But again, I think an overall set, not for each individual employee, but just like you have a position description, you have a competency level. And again, that's fairly common.
Yeah.
Yeah, that makes a lot of sense.
And then the other thing that I would just like to ask, would it make any sense, looking long-term, because this is not a new problem and it is not going to be solved next year, would it make sense to build into the capital budget or capital plan a 2 or 4 units owned by the housing units owned by the county to be used for the 3 months hire? If somebody needs it, they come in, charge them a market rent, but they have a place that they could move into while they're looking for other housing. I don't know exactly how that would work. That's something for EDA or the HRD or whatever. But just wanted to throw that out there to something to consider in the next budget cycle.
Yeah, I appreciate you bringing that up. We have discussed that, and I think we're considering it, although waiting until the units are asking for applicants or built, but yes, we are discussing that and how that might look.
Alternatively, enter into a long-term contract on existing housing units so that these are the county-owned or city-owned, however you want to work it. These are the city-owned things available for 90 days, possible extension if there's no other demand for it. But someone will know and that gives them their time frame. Okay, you got 90 days to be here. Start looking, seriously.
Yeah, and once those units are built, I think we're going to have a lot more flexibility with that. Currently, I think it's a little tight to be able to find anything long-term, but yeah, I think we're trying to navigate that and include it in the budget as well.
Thank you.
So I think it's a great suggestion, and like the way you think.
And
Commissioner
final-
Stoyle, I'm sorry.
Final part of the question, Allison. I have a colleague who looks very like you. His name is Amy. Her name is Amy. If you give us an idea of what the housing they're looking for, that would help me be able to steer them towards some things that I'm aware of.
I'd be happy to have that conversation with you offline, Frank. I don't
Thank
know
you.
that that's appropriate for a public meeting.
Great. Commissioner Stoyle.
Thank you. Yes, there was a discussion at our district meeting, which consists of 7 counties we get together. And I'm on the health committee, and it's an ongoing AMC, Association of Minnesota Counties, concern. And we did have a chance to vote, and one of the areas that I voted for was training and how do we handle all over the state. We have a situation here, but multiply that by 87 counties, or 86, because we have 87. So we're working on it at a higher level also for the training, and it would cooperate then with what you're doing too. So it's on board, just takes time.
Yeah.
Maybe we can do more at the next meeting in December and so on and so on, but it is a highly discussed topic.
No doubt. Yeah, Allison, please.
I would just like to add to, in regards to the housing issue, it's definitely been a huge barrier recently for some of our recently hired I'm trying to think of how to say it, individuals that have been offered positions that are still trying to locate housing, including David. We still have a deputy sheriff who's also moving in from out of the area, and his start date potentially could be pushed back as well because they are also searching for housing. During my meeting with David yesterday, he has posted on various platforms. He's utilizing Boreal. He's looking on Facebook. John and I have been sending him listings just to make sure that he's seen them. Recently, there was a 1-bedroom, 1-bath apartment, not a kind of seasonally long-term rental, because we see a lot of those this year being posted where they're like available now through May, and then someone has to relocate. There was actually one that was a year-round long-term rental. It already had over 360 some hits on it. So that is the barrier in what our potential employees are facing. And we have people who want to come. David is very aware. He wants to get here, and he is trying as hard as he can. We are trying as hard as we can to try to help navigate and direct housing opportunities to our various staff that are looking to relocate. But man, it's very difficult. And like Allison said, we have gone for how long without hiring some of these positions, children mental health, the coordinated crisis response worker that David's been hiring for, but we just don't have anyone locally that meets the minimum qualifications, that's interested. Again, there are specific requirements that they have to meet per DHS requirements and Minnesota statute to be hired into these positions. And so we really kind of don't have options besides hiring from outside the county. Same with our deputy sheriffs. So there are some positions that we do unfortunately kind of have to go through these issues and troublesome situations to just get them here to fill the positions.
Yeah, we struggled with that with our previous EDA director, and we'll be discussing it again with our next EDA director. And and I think it's a pretty regular discussion at this point. Back to the DHS specific onboarding and training too. I mean, obviously the next level onerousness is because of the sensitive nature of the positions, and a person could ask like, okay, how much is this costing us to do this training, right? Another way to look at it too is, what kind of liability could there be for the organization if a mistake was made regarding sensitive information? I think both personal integrity and privacy is so important, but then also just that liability, I think, could be quite great. So I think it's important. I'm just not familiar enough to know at what level, right? And that's what I think it sounds like AMC is talking about, and the concern here. So good discussion. Is there more we should know? Okay. Well, in which case, I guess I'll move the items down to board action then, and we'll just move on with your report, if that's okay, Allison?
Okay.
Okay.
So the updated organizational chart was included in your meeting materials. We have had 5 new hires and promotions since the last meeting, which is pretty remarkable given our recent, not so recent, ongoing multi-year struggle to fill positions at this point. You met Betsy this morning. She started on the 23rd. Nancy also started, Nancy Deming, in her new role as the Children and Family Services Supervisor on September 30th. David Ritmo started on the 30th as well in that Coordinated Crisis Response Worker role. We will invite David to a future meeting for an introduction when he is here on site so that you can meet him face to face. As I mentioned, he participated in a tabletop exercise in his first week with department and staff from Grand Portage Human Services, North Shore Health, and law enforcement. He also attended last week's local mental health advisory council to get connected to other providers and community members that are working to support mental health in Cook County. Also, just to add additional context to the discussion around training specific to mobile crisis response, in order to meet Department of Human Services statutory requirements, there are 30 hours specific to that content area that a person must achieve before they're able to provide that service. So that's above and beyond any county policy onboarding, department policy onboarding, and all of the other systems that staff work with within our department. On consent agenda, under items for board action now, we have Kristen Pedersen's hire as an eligibility specialist. She will be starting with us on October 29th. Marissa Eckel was offered and accepted the Children and Family Services case manager position. That's the new position that was approved at the August meeting, and she has a projected November 12th start date. Recruitment continues for our children's mental health case manager and licensor position. Those positions closed yesterday afternoon, so I anticipate that we'll have a list of candidates referred. Hope that we'll have a list of candidates referred for those positions yet this week. Molly and I are working through contract revisions with the temporary social work agency to incorporate her recommendations. Have also sent that to county administrator for review as directed by this board. So hopeful that we'll be able to have a contract executed and conversations around placement of a temporary worker here in the coming weeks. Overtime expense continues to be a concern with prolonged vacancies in these positions. As of October 4th pay period ending October 4th, we have 1,930.4 hours of overtime and comp time paid. That expense translates to $81,349 year to date. That includes overtime, comp paid, and leave payout when leaving appointment. So urge the board to consider the risk of not filling positions, that this falls to the staff who are currently working to maintain that client care while positions are vacant.
Allison, I'm sorry to interrupt. James is just having a little hard time hearing. On the phone you said, James, so maybe not the microphone? Can you hear us, James?
Sorry, I'm on mute. I was having, because my connection is by phone, I'm just having a little difficulty hearing Allison. Sorry about that.
Okay. But over the phone, okay, sorry.
Right. I don't know, Allison, if you can move your mic a little closer, perhaps.
Well, that's what I was like. I think that'll be on the YouTube, not on the phone.
Yeah, I think I'd have to move the conference unit to increase my volume for you, James, if you're by phone. I can try and project over the microphone. How about that?
Oh.
We'll do what we can.
Okay, sorry. Yeah, that makes sense. Sorry about that.
Nope.
Was there a question about the overtime report, Commissioner, or would you like me to continue?
No, it was just the volume thing. My apologies.
Allison, was the overtime offset by budgeted salaries that aren't paid because no one's in the position?
I would have to look at a detailed salary report to let you know with certainty. I imagine, at least in part, the overtime expense is offset by the unfilled vacancies within the department, yes.
Thank you.
Last staffing update is that we're recruiting for in-home support providers. These are not county staff, but they are independent contractors who are overseen by our in-home support coordinator, who ensure that we provide the necessary oversight for that licensed program and match program recipients with individuals needing that level of support within our community. So call the office directly.
And what do they do, and is there a particular skill set required?
So there's a range of services provided by our in-home support programs: transportation, homemaking, respite, meal preparation, getting people to appointments, supporting them with socialization, community integration, light housekeeping. It's not a direct care service, so it is not skilled nursing. It is
like an aide
support.
Kind of, yeah. I've known a number of in-home support workers over the years and currently, and the people that I talk to that give the support love it. It's just such a fun interaction, helpful, and just the I don't know, the give back kind of thing, you know, it just is a really feel good service. And then the feedback that I hear from the people who receive the support is just, it's life changing because getting that help just makes all the difference in somebody's day and world or life, you know. So it's just a wonderful, wonderful program, and can't speak enough about it. I haven't done it, of course. Maybe I should, but I'll certainly keep spreading the word, Allison.
And what's the range of contract rate?
I don't know that offhand.
Just roughly how much do people, is it a living way, can they afford to live here and provide that?
I'd hate to misquote. I would say no, a person could not afford
Right.
to live here, and
Okay.
these are very part-time roles. So
Okay,
oftentimes
good.
people are working multiple part-time roles.
Yeah, well, we're-
I want to say it's a $16 to $17 an hour rate. Private pay individuals might be able to pay more to their provider, but we are constrained somewhat by the rates that we are able to bill the state for to provide these services through Department of Human Services waivers.
so this is a state-funded, but locally implemented.
Partially state-funded, yes. There are
Partially
county
state.
tax levy dollars as well that are used to support this program.
Thank you.
And then there's also the private side too, right? There's the different
partners,
options.
yeah.
There's that.
Yes.
Yeah. I think we've had a presentation. I don't remember when now. Not too long ago. It's still in my recent memory. Was that all in your?
That, on the topic of staffing and transitioning into department updates, we are actively in the process of exiting the DHS merit system, which is one, along with housing, childcare, cost of living, one of many barriers that we experience in filling vacant positions in our department. Minnesota merit system, or the timeline or what that's looked like for her as she has really dug into that process.
I don't have any specific questions. I know just enough to know that other counties have trudged through it, and thank you for the efforts, but there, because it's, another onerous level, and appreciate looking beyond it. Commissioner Johnson, please.
Thank you, because actually I was going to talk to you about this afterwards. This came up at the district meeting from Carlton, because they are also working on getting out of the merit system, and I wrote it down because I thought, I think we're talking about that. So I wanted to get more information on that. They are working with the HR director from Aiken County. And I'm wondering if you've also reached out in that way, because it sounds like she has a lot of experiences with this, and they have contracted with her to help them through this process. And so I wondered what we're doing to get help with this process.
I just told Melissa, I've got a mom voice. I can project pretty well. Yes, so I am also actively working with Gary Jackson, who's with Carlton County, and Bobby Danielson, the HR director with Aitken County. I've also reached out to Cammie. I think this is the year perhaps they're going through their kind of one-on-one consultation with Merit. So they've already submitted their paperwork to exit, where us, Cook County, Carlton, and Aitken are working on our paperwork to submit. So yes, so I've already been networking. I've also been in discussions, had some support with this through DDA and Tessa, who we work with for our job description review process. They do provide support and assist counties through this process for an extra fee. I have not gone that route because of the information that I've already been provided and working with those other two HR directors. I don't find a need to have to pay for something that I'm pretty much almost done with. But through these various resources, yes, we're all commingling, and it's pretty boilerplate language for filling out the forms and submitting to DHS, to the merit system for this process and certification to exit.
Thank you for that clarification and hearing that you're working with the other counties. So
Oh, yeah,
I just wanted to verify that.
I don't want to recreate the wheel if it's already been
Thank you.
gone round and round several times in the state of Minnesota. Yeah.
Any other questions? All right. Thank you.
Wonderful.
Any other staff or agency updates?
I do have a number of other department updates before we move into items for board action. Wanted to have a more robust report since we don't have a staff report. And thank you, Allison, for being here this morning.
Have a good day, Allison.
All right. Financial report included in the consent agenda. We continue to be over budget in children and family services and out-of-home placement at 163% and 151% respectively. We did receive an additional revenue of $16,462. This is North Star foster care payments that were received in July. These were labeled as Q4 2023 revenue, but applied to our 2024 budget due to the point at which they were received. So that did bring our revenue under out-of-home placements to 120% for year to date. Again, this is also due to the increase in expenditures. Crisis response, Caseworks is in full force across the entire agency at this point. We had our go live for economic assistance and healthcare programs on the 23rd. So week 4 in the new system for that area of our agency. Within social services, staff are in end user training this week with a go live next week.
Wow.
I mentioned the crisis response tabletop exercise on the 4th several times, but want to express gratitude to the staff who planned and participated in that, as well as the other agency partners who are all also at capacity, but took valuable time out of their Friday morning to walk through that scenario, which was an individual with suicidal ideation who was interacting with law enforcement and emergency department staff. So a valuable exercise for us to talk through expectations. What do we want to happen in this situation? What has happened in the past? How can we get on the same page in terms of how we're working across multiple complex systems that do not use the same language, have very different policies and cultures? How do we best support individuals in crisis in spite of the complexity and capacity issues? We also had an emergency preparedness tabletop exercise last week. That scenario was a severe weather event with freezing temperatures, power outages, and road closure. Commissioner Sullivan was also in attendance there, so I'll save any detail if you wanted to include that in your report. Our Prevention Coalition continues to meet monthly. This is the Suicide and Substance Misuse Prevention Coalition. We are meeting this afternoon from 1 to 2:30 at Cook County Higher Education with a Zoom option as well. There's been a lot of discussion within this community group around cannabis education, who the audience is for cannabis education, the platforms, credible voices to deliver those messages, with a focus on parent education after winter break. These efforts also dovetail with the lockbox distribution that you all approved the funding for last month through some of our opioid settlement funds. In November, the group will have a training on positive community norms with our regional drug and alcohol prevention coordinator through the Community Health Board. In terms of community outreach and events that our staff have led, supported, participated in, on September 21st, our staff supported events in Grand Portage, including the first ever bike rodeo in Grand Portage. Bless you. This was a part of the Suicide Awareness Weekend and the first bike rodeo in Grand Portage with around 15 people participating. On September 27th, the Human Services Leadership Forum took place in Grand Portage. A number of our staff participated in a panel presentation along with Grand Portage programs and human services staff. I want to thank Andrea Orris, Brent Port, John Speaker, and Nancy Deming, who co-presented with me, along with the Grand Portage panelists, who included Programs Administrator Anna Shaw and Leslie Olson. At this meeting, we talked about how we work across human services organizations to support residents, specifically in the area of behavioral health and children and family services. It was a great event. Grateful to the Grand Portage Band for hosting, and for the staff involved in this work. And it was really a unique opportunity to be recognized as a small community by a room full of state leaders. So that was pretty special.
Seems like only yesterday.
And grateful that you were there, Commissioner Mills, to represent the county
honored,
leadership.
Yeah, honored to be there. And it's the second deputy commissioner that I've gotten to meet, and so that was pretty neat.
Yeah, it felt very new with newly appointed commissioners from the newly established Department of Children, Youth, and Families, and
I guess that's the third then, never mind, sorry.
and a chance for us to talk about how, as a small agency, we are really uniquely impacted by some of the challenges with our state systems, the lack of functionality, how that impacts our ability to be in compliance with ICWA despite our efforts, that's the Indian Child Welfare Act, despite our efforts to be good partners and to do good work in support of Indian families in our community. We still have barriers systemically to achieving that 100% compliance, specifically around documentation.
Yeah, it's very, I feel, and maybe this, I wasn't aware of it before, but I feel like there's now more of a push from the state to be getting out into these smaller communities to hear directly. I don't know if that's your impression as well, Allison, or if there is a published concerted effort there, but I've just been really impressed with that. That face-to-face time with state leadership is very powerful. Just to have that little connection, you know. It's not like we're best friends or anything, but we've met, we've talked, you know. It's powerful.
We're at a unique point with the reorganization of the state agency
Sure.
to engage in different ways than we had previously.
Yeah.
So again, thank you, Commissioner Mills, for
Thank you.
being there and for your leadership at a state level and participating in that advisory group as well. I think that's a really meaningful way to have our voices heard as a small community.
Mhm. You bet. Thank you.
Where did I leave off? Oh, other recent events. Within the last couple weeks, I was invited to present to Grand Marais Library staff on public health and human services programs and services, and that was another unique opportunity to connect with another critical community provider in a different way and look forward to have ongoing outreach and partnership with the library team in terms of helping them connect folks who could benefit from public health and human services programs and support. Last Wednesday, the 9th, was Walk and Bike to School Day. Last Friday, the 11th, was Cook County, our second ever Cook County Warrant Resolution Day. We had 3 people come to resolve their warrants. So continuing to expand the impact of that work. I want to thank Brenda for her leadership there in initiating and supporting residents getting to that event.
We tripled the success.
We did. And what was reported to me is that 2 of the people who participated we had been working with, and 1 was someone who hadn't interacted with our department before, so another way to connect with residents in a different way.
Great.
Continuing outreach throughout the month for Substance Use Prevention Month in October, and then the LGBTQIA 2 Spirit Plus Youth Group resumed in September on the 18th. I'm going to move into my introduction for the business agreement with Qualifacts, unless you'd like to take the staffing items for board action first.
Go right ahead.
Okay.
Thank you.
So last month, this board approved a motion to delegate authority to me in contracting with an electronic medical record for behavioral health services that includes mobile crisis response program that is in development and the existing wilderness outpatient treatment program. Our team met with 2 different vendors to evaluate and select a system. That team included billing, clinical, and administrative staff. The expense for this system is included in Cook County's 2025 Department of Human Services Crisis Grant application. We have assurance from the state as well as the Arrowhead Behavioral Health Initiative that our request will be funded, but we have yet to receive a formal award notice. One factor that influenced our selection of this platform is that the Human Development Center, or HDC, is using another Qualifacts platform for their provision of after-hours and weekend mobile crisis response services in Cook County and throughout the region. This vendor provides hosting as well as ongoing technical support for the software, which minimizes the resource impact on our Cook County MIS team. With appointment reminder and state reporting functionality, we anticipate cost savings in the amount of staff time dedicated to following up with individuals on appointments or on information that we need in order to successfully bill for services. We also have persistent issues in our substance use disorder treatment medical record with duplicate entries, which creates significant staff time burden across administrative, clinical, billing, and reporting areas. The return on investment 1-pager was included in the meeting materials based on time reported. Again, this was based on time reported conducting manual eligibility and billing, following up on claims issues, a lack of integration with state systems, and missed appointments. As I mentioned, the Arrowhead Health Alliance and Arrowhead Behavioral Health Initiative has approved a regional mobile crisis response budget, which includes fully funding the request from Cook County, which will fully offset the expense of the electronic medical record system. I have assurance from the state that there will not be any issues with certifying Cook County to provide mobile crisis services, and that we will have a contract and certification letter from DHS before September 31st, 2024 for the 2025-2026 calendar years and budget years. So what I'm looking for today from this board is one of two things. Either to approve the business agreement as it stands, pending final review by the county attorney, or delegated authority to sign the contract pending final review by the county attorney. So both contingent on Molly's final review and approval. Yes,
We're talking about the Qualifacts
we are talking
agreement,
about the
right?
Qualifacts agreement.
Yes, I have reviewed it. The only thing I would ask is that they show us a certificate of insurance, of professional liability insurance, prior to signing it. But it has all of the other protective elements that I'd be looking for. So I approve.
Excellent. I have a question just in regards to the HDC. It's not that there's going to be like any integration. It's just that they also use it, and so it's almost like vouching for it, right? Like they've shown that it's been successful for them, and so, right?
Yes,
Yeah.
it's not going to be possible to fully integrate with the Human Development Center by using their platform. We explored that for some time as they're serving the entire region, and they're providing a wide range of behavioral health services as a certified community behavioral health center. So the strategy to look at vendors that are already in use in the region is yes, for that vetting. This works here in Minnesota with our state reporting, with our licensing requirements. And in our staffing model for 2025, we propose being the crisis response provider, being the subcontractor with the ABHI for mobile crisis response, and subcontracting with the Human Development Center through Cook County rather than through the ABHI to provide that after hours and weekend crisis response. So assuming they maintain the staffing that they have, this would be a comparable program to what they're already using to provide crisis response services after hours and weekends.
Thank you. Commissioner White, has there been much discussion at AHA about, these awards or this transition? Or?
No, excuse me. No, I was there just a couple days ago, it seems, last week. And Cook County was discussed quite a bit in a very favorable manner about it. And you, Allison, you had just been there the week before or something like that. And so that was the first time I was actually there with, there were only 2 other people there, but everyone else was zooming in. But it's I was at Yellowleaf, which was quite an impressive facility. Actually randomly met some of the people that are getting services or having that as a safe place to house for a while. And no, there was no specific, as they were speaking, I'm understanding that they are really the experts, and I have a lot more to learn in what they were talking about. So,
A lot of ins and
but
outs.
Cook County and Allison's name came up many times, as did Brittany's. What's her, Anderson, from Grand Portage. So, no.
Okay, yeah, just,
I did point out that we did get a crisis person hired now, but they would have to come to you for details on the training process that and where the person is. So, and that was the one thing, so.
thank you. Okay, are there questions regarding the agreement here? Commissioner Johnson?
Yeah, I just want some clarification. So is this we approved this is a 2024 expense showing up on our 2024 expenses?
That is accurate. There's no way to implement the system and be compliant with the Department of Human Services effective January 1. It's a 4 to 6 month implementation period. So this will be a 2024 expense. We will receive the revenue in the first quarter of 2025. So we'll either be able to apply that revenue to 2024 or offset the expense of that coming from fund balance as an unbudgeted expense in 2024.
And so that brings me to my next question, the revenues then, if showing up in 2025, in the budget, the preliminary budget that we were presented, is that in the revenues in that budget?
It is not, no. And it isn't, the revenue is also not reflected in the 2025 budget in terms of the impact that that would have on our staffing expense as well, as this would offset the expense of our mobile crisis response provider in 2025. So significant additional revenue expected before the end of this calendar year, as we reported earlier.
And I think it's important for our board to know, because we're having a discussion at the very next meeting about our budgets, and it's important that we have all information of what changes, and I didn't see that listed on there, so we need to be aware there are additional revenues coming in through PHHS that are not reflected on the information we've already received. So whether or not we decide to, because if it does come January, you can do the accrual basis, you can count it for 2024, or you can say it's 2025 numbers. So that's important for the board to understand. There's more information that we need to consider when we are making decisions about our budget for 2025. So thank you for that clarification. And if we could get that dollar amount, that would be very helpful.
I can point you to where that was in previous reports that
Thank
I've
you.
made. Yeah, absolutely.
A good question. Any other questions here? Any motions here?
Mr. Chair, I'd like to move that we approve the business agreement with Qualifacts Credible Behavioral Health Electronic Record Platform pending certification of the professional liability insurance.
Thank you. Thank you, Commissioner Sullivan and Rana. We have a motion and support. Further discussion here? Hearing or seeing none, all in favor?
Aye.
Aye. Opposed? Motion passes unanimously. Thank you. Thank you, Allison. And that leaves us with 2 other items for board action. There's item F that we pulled from the consent agenda. That's the hire of Kristen Pedersen as an eligibility specialist. And then item G is the hire of Marissa Eckel as the Children and Family Services case manager. Are there any motions on those 2 items?
So we're just going to approve hiring them? Is that what we're approving, or approve?
If it
more
is
discussion?
moved, and yes, yep, the intention is to hire our eligibility specialist and children and family services case manager.
I move that we do that.
Okay. We
And
have-
I'll make a second.
Okay, we have a motion from Rana and a support from Commissioner Sullivan. Any further discussion there? Hearing or seeing none, all those in favor?
Aye.
Aye. Opposed? Motion passes unanimously there as well. Excellent. Thank you. Down to committee reports. Active Living Steering Committee, Commissioner White.
I did not attend that, and I was in Grand Portage at the 24th Annual Great Lakes Beach Association Conference they had up there. And then for the AEOA, the second one, they are meeting tomorrow.
Okay. And then we talked a little about AHA already. ARC, Commissioner Johnson.
Well, I already informed the regular board, but they will be doing interviews because Wally retired. And so they are doing interviews next week for the executive director position. Phil Greer has been out, he's probation person, so I'm going to ask county attorney, they were talking about, they made an offer for a probation officer, did that person accept, do you know?
I don't know.
Okay.
I don't even know who it is, yeah.
Okay, so then we had a probation position that I don't know if it's been accepted or filled yet. But I have a meeting on Friday, I will see Phil in person and ask him.
I believe that it has been accepted.
Okay, thank you.
Great. Thank you. Child Care Solutions Subcommittee, Commissioner Story.
We've not met.
Okay, thank you. The CHB will be meeting, I don't know if I reported on a personnel committee, that meeting I had with them, just going over, trying to keep up with the Joneses as far as competitive pay. And it's interesting because so much of it is funded from state grants, and the increases are written into the grant, and so there's not always a whole lot of wiggle room, but doing everything we can to try to ensure people stay with the CHB, and we'll be bringing that to the full CHB board with a recommendation. But just grateful for that foresight and just awareness of course, the churn and the market. But we'll be meeting next Monday in Duluth. And then we have the local, please, Frank.
If I may add.
Yeah.
Coming up on the next Community Health Board meeting, which is Monday the 15th, Monday the 22nd, I'm sorry, right?
Or
No, I'm sorry. It's
21st?
It's October 21st.
Yep.
We're going to be having a presentation by CDC's Director of the Office of Rural Health. And I'm bringing that up here and now because this is open and encouraged to bring in all members of the Arrowhead public health community who would be interested. And I believe Allison is sending out invitations to the Advisory Council, to the Mental Health Advisory Council, Commissioner Storley. Maybe this would be something that the Health Committee of the 7 counties might be interested in knowing about. Of course, it'll be via Zoom, and we can certainly send out additional Zoom informations. The more the merrier, and the wider spread that we can get to show Director Hall the level of interest, but also to raise your questions and concerns with her. It, not so coincidentally, is she works in my part of Centers for Disease Control, and she's asked me to sound out the audience on what they would like her to talk about. So this isn't only going to be a top-down. She's very much interested in what your concerns are. It's a relatively new office. They have a lot of resources, some of it financial, some of it informational, and I'd like to extend that invitation to all of you. And Allison, would it be, should we send invitations, Zoom invitations to the to the Public Health Board, and any other entities that you think would be appropriate. And Director Michaels has already certainly agreed to this, and she's also extending it to the other counties that are part of the Community Health Board.
Do you have a time?
1:15. That's her section. The board itself starts at 12:30, but her time is 1:15. You could certainly welcome to chime in earlier. I believe meetings are open, right?
They are open, but they're noticed as open meetings of the Cook Carleton Lake, St. Louis Community Health Board. I believe to meet the requirements of open meeting law as it relates to the Cook County Board, we would need to notice that separately if a quorum of commissioners were anticipated to be present. Is that correct, Molly?
I got distracted. I'm
Yes.
sorry.
Yeah.
What was that?
So Frank suggested inviting the entire Public Health and Human Services Board to the CHB meeting, the Carleton Cook Lake St. Louis CHB meeting next Monday, the 21st. That is an open meeting of the Community Health Board. However, if a quorum of Cook County Commissioners were to be present, we would need to notice that separately.
That's right. We would need to notice it.
And we have 5 days in which to do that?
3.
3, okay.
So I will be there in person. However, I need to leave early. Is there other interest, virtual or in person, to be there? I'm sorry?
Possibly.
Possibly, yeah.
Checking.
I'd be interested.
Okay, yeah. So is that something that we're going to be able to notice?
Then we should.
Will we have that time? Okay. Okay, we can do that then?
We should be able to do that. I don't know what the forum would be. We're typically noticing meetings through other public meetings. So Molly, I might have to talk to you about that offline in terms of how we notice it as a special meeting. I don't,
Yeah, I think we should talk to Jana.
okay.
And also, I'd recommend talking with Susan Michaels, because they can notice for our courthouse virtually. So I don't know if there's the virtual option available or in-person option of notice. I don't know how you notice for both. That is beyond my.
I've done that with other organizations, so we can work on that and work with Jan.
Commissioner Johnson?
Yeah, I'm just wondering about this, and I thank you for bringing that up, Frank. Is this something that is also appropriate for, like, possibly the hospital board?
I would think so, yeah, sure.
So I would try to make sure that they get an invite. I think it's important that we make sure we think about inviting all the
Yeah.
various entities that are providing services in our community, that, to make sure we're not in our own silo and not sharing that information. So I'd encourage you to reach out maybe to Kimber and ask that gets shared there also.
So, Allison, with that, I'm happy to do that. Should that come from me, or should that come from Health and Human Services?
I'd suggest Susan. Susan Michaels, our CHB director.
Should talk to the hospital board?
I think that the invite would be coming from the CHB, because it's not PHHS's meeting, it's the CHB's meeting, so that invite needs to come. But what I was going to mention is that Commissioner Storley is also on the healthcare planning committee, which includes Sawtooth Mountain Clinic and the hospital, and I don't know who all, so that group might want that invite.
That would be a better one.
Right,
Okay,
yeah.
so
So that's kind of
what I mean. I
that's
wanna
kind of
make
the
sure
whole
we're-
That should come
healthcare.
from,
Yeah. So I don't know
Reaching
who the
out.
contact is there, though.
I'd be happy to facilitate
Okay.
that by forwarding the invitation from the CHB director,
Okay.
Susan Michaels, to our advisory councils and the healthcare planning committee, which includes leadership from the hospital.
so let's talk about the logistics of that after.
This could be a very interesting.
And then also, this does include the personnel from Grand Portage. Will they be invited?
Yes, Grand Portage Health Services staff are represented on healthcare planning and human services staff, and the Public Health and Human Services Advisory Council, and several staff from Human Services are on our local mental health advisory council.
And the Mental Health Advisory Council too, because she's very much interested in that.
Yes.
It's a area of concern, not just to us, but throughout rural health.
Absolutely, it's the top issue identified on most community health improvement plans in the region
Yeah.
is mental health.
Yeah. Well, we'll fill the room, huh?
Fill the ether.
A long talk about the crisis response group, and also Scott Dahl talked about children's mental health case management, youth groups at the school. They're having some social lunches at the log cabin. I don't know if is that with students or just adults, I don't know.
I think that's
Right.
probably the
The students.
LGBTQI.
Yeah.
Yep.
So that's going well. And Scott Dahl talked about From Credible Minds, and he said that it's often 11 years before people really get help with their mental health problems, that they suffer a long time before they realize it or how to get care or all those things. So it's really, he said it's like the tip of an iceberg where 83% of people just walking around probably have undiagnosed problems. So that's something to keep in mind when you're meeting with people and learning about people, and it's an issue.
Even the
Yeah.
smallest things can be traumatic, and
Yeah.
that compounds over time and just builds and builds. Just even things
Yeah.
you wouldn't even think of,
Yeah.
It's
So
incredible.
I think it's great that we're having more services at the school to be able to get kids involved younger to maybe prevent some of this future problem without any help. So, and we talked about how to stay calm in emergencies, and work on resilience. Anything else? State grant. A lot of the same things we talked about today was introduced, at that meeting. So.
Okay. Thank you.
If I may, Rana, just add a couple things to your report. The local mental health advisory council reviewed and gave input on the children's mental health screening grant that was approved on the consent agenda. And just to add a little more context around the presentation on Credible Minds, I anticipate this will get confusing
Okay.
in the future, as Credible is the electronic health record that we are contracting with
okay.
for mobile crisis response and wilderness outpatient treatment program. Credible Minds is a mental health resource platform that we are exploring through public health outreach and health promotion. It's in use by other health departments, community health boards throughout the state to share evidence-based, vetted, local, regional, state, national mental health resource information with communities. So that was our first demo and presentation of the
Okay,
Credible
thank you.
Minds platform.
Boy, that is confusing.
Yeah, well, yeah. I'm looking forward to that.
Yep, okay.
Well, thank you. And thank you for that clarification, Allison. I'm sure I'll need it again. Council on, or I'm sorry, the Restorative Justice, Commissioner Johnson.
Well, let's see, they're still working on becoming their own nonprofit. That's in the process, and so that they can get some grant funding. I brought up the minutes here so I could say this correctly. They, Rachel Clark, who was holding volunteer meetings, but there, let's see. Rachel created a Cook County Restorative Justice Instagram page for those who use Instagram, and she was working on a RJ Facebook page. So if you're on social media, those two, you might want to check that out. I have not done that yet because I kind of avoid that kind of stuff, but I've been meaning to get to it. Just not. So, but put that out there because that's where they're going to be sharing more information. And so if you're interested in that, you can look them up on those two social media sites.
Yeah, that'll help get the word out for sure. Yeah. Great, thank you. Council on Aging, Commissioner White.
Yes, they had their meeting yesterday, and there was quite a uproar over renting their space to a particular group. And I would like to read the Cook County Council on Aging offers its facility, the hub, for use by individuals and community groups regardless of race, color, creed, gender identity, sexual orientation, religion, natural origin, familial status, age, disability, political affiliation, veteran status, and or any other status protected by law. So the hub is not a county-owned building, and they are a nonprofit, and their charter requires that they are apolitical, non-discriminatory, and they rent spaces to anybody. And this is about social media, where there was a person who did not have all of the information, but was very unhappy, which one can be, that a group was going to be showing movies at the hub. And there were many very unkind phone calls that came into the hub to start with, to the people that work there and to the board chair. And then, I'm not on social media, but some of the other board members followed it. And as the string went through, where people joined on the conversation to say, to defend the hub's policies, the initially distressed person eventually ended up saying, well, I know more about this now. So it just goes, this has happened many times in this community. Social media distorts and inflates a situation or a problem that actually isn't a problem. And it's not beneficial to anyone. So I would just like for people to understand that if you are reading something on social media, it doesn't mean it is 100% true. And so before you go out there and then cause harm and bring on more energy, negative energy into a situation that does not deserve it, and for people to have to take the brunt of some other people's ire for something that is not true, is just so wrong. And it has happened in this community before, and it's not acceptable. So I would like to hope the public will understand that don't accept what you read online as truth. So there's that. They're also having a chili feed on Saturday. Right. 3 kinds of chili. It's a fundraiser. So there's that, a little balance.
3 kinds of chili? Wow.
Vegetarian, yeah.
I'm intrigued.
Oh, Lordy.
Thank you. Well, I'm sorry that happened and took so much. I mean, clearly it
It
had
was
an impact.
very distressful.
Yeah, I saw it on social media, and I knew it was wrong, but I'm sorry the staff had to be
Yeah.
bothered with that, because they work so hard anyway.
Yeah, very, very emotionally trying for them. Including the cook,
Oh, gosh.
who got some of the phone calls when the other person couldn't pick up the phone anymore.
Oh,
So,
terrible.
to our Cook County community, social networking people, you're smarter and better than this.
I guess we'll move on to the Emergency Preparedness Committee. Commissioner Sullivan.
Well, just to follow up on Director McIntyre's remarks, we did meet last Tuesday for an hour and a half, and the group is committed to doing more tabletop activities in the coming year, and as she mentioned, it was related to severe weather. So the scenario was that there was a windstorm, there was flooding, part of 61 was closed down in the area of Tofty. And we talked about the fact that the grade is closed, which changed our emergency routes, but it was a really excellent tabletop. And I happened to be in a Zoom room, a pull-out room with our Rowan Watkins, Director of MIS, our Highway Department, Matt Nesheim was there, and the U.S. Forest Service had Ellen Bogardner-Shamaniak. And one of the really important things that I learned through the tabletop is when they looked at the flooding, and this, of course, was based on a scenario that happened in Cook County not too long ago.
I was gonna
that
say too soon.
Yeah, employees could not get to the Tofty Ranger Station, and she would have been there alone. She would have not had capacity to get out to campgrounds, to help individuals. So it was a really interesting scenario to talk about when mobility on Highway 61 is impaired by downed trees or power lines or water, whatever it might be, that it impacts the services that can be provided to the wider community, in this case to visitors in U.S. Forest Service campgrounds. So I really appreciated the activity. It talked about the importance of coordination with the Sheriff's Department, search and rescue, prioritizing road cleanup so that we could get to people that were in harm's way. But I'm really looking forward to having more of these tabletops. I think it's really going to improve our capacity to respond in the case of emergencies. And one important thing that came up, and it's come up before, is the importance of making sure that for those visitors that are staying in vacation rentals, that they have emergency information that's provided in their vacation rental unit, so they know what to do in case of emergency.
Very good point.
Really excellent.
Practice makes perfect there.
Yep.
Alice?
Yeah, I just want to acknowledge that for, I believe, the first time, at least at a tabletop exercise, we had participation from Visit Cook County in the Chamber.
Yes.
Executive Director Linda Jurek was there, which was a valuable perspective on that issue specifically,
Yeah.
Commissioner.
It's been really nice to expand. Visit Cook County, the Chamber, and WTIP have been added to our emergency preparedness group, and it really helps with communication.
And if I may, I neglected to acknowledge Andrea Tofty for her role in planning, developing, and leading that tabletop exercise. Going back to capacity, this is a tangible example of how, as a stronger, more robust public health team, we're really able to provide leadership and support on planning and preparing for these critical issues that could impact our community.
Absolutely.
Excellent, thank you. Healthcare Planning Committee, Commissioner Starley.
We have not met, but I'll move on to NACO.
Okay, thank you.
Because we have met.
Yeah.
So we, every year, we get a new president of the health group, and this year we have Honorable Phyllis Randall from Loudoun County, Virginia. They're called supervisors instead of commissioners. Interesting switch on the name, but that's beside the point. And she is a go-to gal. She wants all of us to start thinking about how do we address our whole health. And she feels there's like 4 or 5 planks of health, which would be physical, dental, sexual, moving on to substance dependent, mental health behavior, and more education on the entry of opioids and other addictive substances that is at times taking over our country. And what about our social health, environmental health? And I'm sure the folks in Florida are certainly concerned about the environmental health that's facing them down there. And then the effects of social media and gaming on the mental health of our young people, and some older ones too. It isn't just the younger ones. It was very distressful to hear that she has a concern about a substance that now is being used by some younger people, and mostly on the East Coast, and that is nitrogen oxide.
Laughing gas.
Laughing gas, yeah. And it is legal in United States. It is quite prevalent online, and it can be hazardous to one's health because they've added sulfur to it for inhaling. So that's something that we need to be aware of as it perhaps moves across the country, or who knows if it's already here, we don't know, but she's quite concerned about that impact. So we have a lot of things to think about, and especially to present at our meeting in the first part of March. And then the director of NACO has asked us to, by November 4th, list our top priorities. So probably out of all this, I will add that to the list. And then on November 6th, we're going to meet and talk about the priorities that over 3,560 counties will be submitting to the health organization. So I have a note to myself to make sure I get that online. And that's my report.
Thank you for working in NACO on those issues. Yeah, those national issues, I say, are right here too.
They are.
Northeast Minnesota Office of Job Training. Commissioner Johnson.
Let's see, our last meeting, last month, we approved a cell phone use policy. And we've been working with Bobby Danielson from Aiken County. And I had an opportunity to thank the Aiken County administrator and two of their commissioners for their letting us use Bobby when we had some HR issues that needed to be worked through. And I was just expressed my appreciation of her knowledge and her ability to work through our issues that we did, and everything is working well there. And I found out she owns land in Cook County. She loves Cook County, and I said, "Oh," and she says, "No." So I can't ask her if she's moving to Cook County. She just has land here. Should keep that name on your list if we ever have any openings.
For headhunting, yeah. Thank you. North Shore Collaborative have not met, and I saw it on my calendar, upcoming soon here. And then Public Health and Human Services Advisory Council. Frank.
Yeah, thank you. We had provider updates, and I'd like to just hit a few highlights. The Care Partners is having continues to have a monthly Lunch and Learn Healthy Aging Education program on the fourth Wednesday of each month at Cook County Higher Ed. And that's an ongoing project. The Cook County Council on Aging, otherwise known as the HUB, is working to extend the range of the meal home deliveries using frozen meals, working with Julie to try to find weekly drivers who can deliver frozen takeout to more rural areas. And they're also getting referrals from Sawtooth Mountain Clinic, Cook County Human Services, Health and Human Services, and local churches with regard to their meal program. The Sawtooth Mountain Clinic points out that, can read a brief snippet here, since 2019, uninsured and Medicaid patients in their 20s and 30s, especially those without chronic conditions, have foregone health care in large numbers. That's statewide. Locally, this aligns with Sawtooth Mountain Clinic's data showing that many adult patients without chronic conditions are skipping preventive care and accessing acute care more sparingly than they did prior to 2020. So there are plans underway to improve outreach to this age group, and especially let them know that the financial services available, sliding scale, and so on. In the long term, ounce of prevention, worth a pound of cure. Not only does this translate to poorer health, it also translates to more expensive health care. So it's something just to be aware of on the ongoing, is preventive services are not being accessed to the extent that they had been. Violence Prevention Center, gearing up for the school year, preparing for a Safe and Strong program at Great Expectations School, and that's a K-6 child sexual abuse prevention curriculum that teaches body safety, and also exploring options to offer Safe and Strong to the other schools in the county. And October is Domestic Violence Awareness Month, and we'll be holding a candlelight vigil for Domestic Violence Awareness Month today at 5:30 p.m. at the County Art Colony's Studio One space. The 15th, today's the 15th, right? Yeah, that's today. And that's the report from the council.
Thank you, Frank. Anything else for the good of the order this morning?
If I
Allison,
may,
please.
Commissioner, hot
Yes.
off the presses,
Oh, boy.
just in my email as of
Good
the
press,
last.
bad press?
Good press.
Okay, good.
Governor Walz has declared tomorrow, which is October 16th, as County and Tribal Financial Worker and Case Aide Day. So if I may read that proclamation.
Please.
To offer some public support for our financial workers and case aides. Whereas county and tribal financial workers and case aides provide outstanding service to people in Minnesota through their administration of public assistance programs, and these dedicated professionals are responsible for the prudent expenditure of millions of dollars annually and must meet high standards of job performance in determining eligibility for public assistance. And county and tribal financial workers and case aides are well-versed in several areas and maintain detailed knowledge of public assistance programs, ensuring the delivery of effective services to clients and the public. And county and tribal financial workers address barriers that prevent people in Minnesota from achieving and maintaining self-sufficiency, allowing for the highest possible degree of independence from public assistance. And Minnesota recognizes the valuable services county and tribal financial workers and case aides provide through the delivery of person-centered, culturally responsive case management and accessible community services. Governor Walz proclaims Wednesday, October 16th, as County and Tribal Financial Worker and Case Aide Day in Minnesota. So thank you to all of the Cook County financial workers and case aides for your excellent work every day.
You're here. Thank you. And I should have assumed it was good because it's for the good of the order, right? Just news always gets me.
Sorry to.
No,
scare
that's
you there,
great. That's
Commissioner.
great. Yeah, thank you. Any other for the good of the order? Oh, Attorney Hicken, please.
Well, Commissioner Johnson brought up hiring of the probation officer to fill the vacancy. I did some brief investigation. Yes, there has been a hire. It's official, and Micah Avery will be starting on Monday.
Awesome.
They're still looking for a full-time administrative assistant up there, though. So if you know of anyone, that's an important role, too.
Yeah, big time. All right. Well, very good. We're at the end of the meeting, so we are adjourned.